Okay. All right, welcome everybody after that elegant lunch interlude. We're going to begin our second session that's going to be led by Clay Johnston and Marjorie Spears. Marjorie is here pinch hitting for Alta Chara. Alta was brave and tried to beat an upper respiratory infection, hopefully just a cold or something, but found that she was being defeated by the viruses, so she has retreated, and we have Marjorie in her place. So Clay, let me turn this over to you.
So thanks, Steve. After that great discussion this morning, now we're moving on, primarily focused on randomization. Now we're moving on to thinking about risks and how we can define reasonably foreseeable risks, and then practically what the implications are for the OHRP's guidance recommendations on the definition for reasonably foreseeable risk. Specifically, how does it relate to how will patients perceive of it, how should it be communicated, and what are then the implications for how we'll do standard of care research in the future. So nice broad discussion this morning, really useful on randomization. Now we're trying to really hone in on, okay, what is OHRP telling us in their guidance, and what really are those implications? Here we'll focus on the risk aspects of it. In the third session, the session tomorrow, it's about how it specifically impacts standard of care, standard of care research and in that setting. So we'll try to steer a little bit away from that, but my guess is it's got to come up because we're talking about net risks of participation, and that the setting obviously matters. So this session is identically organized. We weren't all that creative on the planning committee as the one from this morning. So we have 4 speakers and then 4 additional panelists, the speakers each have about 10 minutes, and then there'll be some time for questions from you all, mostly just a couple of minutes after each of those speakers. The other 4 panelists will just have a few minutes to add their comments, and then we'll open it up for a discussion. And hopefully that discussion will include you all from the beginning. Again, trying to specifically address the issue about what OHRP is proposing and how we think risks can be evaluated in that setting. So with that brief introduction, I want to introduce Charles Weyer, who is from London, Ontario, and a professor of philosophy, medicine, epidemiology, and has done a bunch of studies in the ethics of research design, including cluster randomized trials. So thanks, Charles.